Health illness care continuum importance and application. In nursing, a continuum of care guarantees that patients get the treatment they need as their health condition evolves. The health illness care continuum was created with the knowledge that a patient's health may be most susceptible during gaps in care and thus works to address those gaps. With this form of care, patients are certain to receive the proper treatment for various ailments or problems that develop over time. With continuum care, patients with chronic diseases are guaranteed to receive ongoing treatment to control their symptoms or modify their treatment plans as needed. The main advantage of bundling various healthcare services is that switching to a new form of care is seamless should a patient's condition worsen or change. In the continuum of care, patients receive the precise services they require based on their medical history and present health problems. This treatment covers transitions in care as patients age or deal with new medical problems. Patients are followed over an extended period by nurses who provide a continuum of care. In-depth guidance on a patient's health and well-being can be provided through continuing care. The necessity of maintaining good health every day can be explained to patients by nurses who provide this type of care, thus reducing the likelihood of severe health problems and difficulties. This can lower healthcare expenditures and improve patient outcomes for patients with chronic illnesses. Importance of the continuum to health practitioners. The health illness continuum helps health professionals promote the value of individuals as it differentiates between people and their illnesses. Working in healthcare provides a rare opportunity to view the whole spectrum of sickness from an unbiased, outsider perspective. By considering each person as diverse, unique, and possessing universal needs, the health illness continuum explicitly assists healthcare professionals in promoting the value and dignity of individuals. When nurses care for the same patient throughout their sickness and the same illness in different patients, a pattern usually starts to emerge. Health practitioners start to comprehend how the patient and the sickness interact. There is seldom a correlation between experience and illness in clinical practice, as people have different relationships with illnesses. For instance, some people fear getting sick, while others do not consider the severity of their condition. It is prudent for healthcare providers to treat the patient rather than the ailment, as following conventional practice will be too much for some people and insufficient for others. It is crucial to have a conversation with patients about their level of involvement and that of the doctor. Respect and decency follow when nurses treat patients with dignity. When continuing care is implemented, patients may benefit from better outcomes and an overall improvement in quality of life. Nurses are essential in providing patients with this kind of care. Nurses help patients acclimate to needing long-term care for a chronic ailment or issues that arise with age. A reflection on the overall state of health. The standard health position is my average value on the health-illness continuum scale. I do not have severe ailments and consider myself in good health, but I am aware of several destructive behaviors that do not help me stay healthy. My mental health and perspective are other factors that led me to concentrate on a standard health stance. I am aware that sometimes I overthink and analyze situations negatively, but I am constantly attempting to improve on this. When deliberately caring for your body, emphasizing habits is crucial. One of the first tasks is to decide which positive behaviors to start or continue practicing and which ones should be stopped. I believe habits that negatively affect my health include a lack of sleep, frequent consumption of unhealthy foods, and procrastination of exercise days. Some of the beneficial aspects and behaviors I have acquired include having a good outlook on health, adopting healthy eating practices, eating low-carbohydrate meals that lower the risk of getting heart disease and diabetes, and exercising regularly. In addition, I will explore solutions and sources for health improvement that are supported by research. These include public information forums and educational materials on common illnesses that address health problems and highlight ways to prevent illnesses. Options and resources for wellness. I want to work toward high-level wellness from a position of average health, which requires commitment and focus. This entails making plans for how I can successfully improve my sleeping schedule, exercise regimen, and nutrition planning, then following the plan. Various options and services can support my efforts to move toward well-being on the health-illness spectrum. Medical facilities and personnel identify ill health and its sources and offer strategies for improving health. Medical facilities utilize diagnostic equipment to identify effective treatment strategies, such as correct drug regimens. The internet is another resource that can be useful for collecting information on health issues and strategies to improve wellness. The neighborhood fitness center provides a resource for exercising and enhancing physical health. The family support system is also essential in promoting good health by creating a supportive environment.